Marc, can you talk about your professional background and how did you start researching in the psychedelic field?
Yeah, so I started as an engineer. I studied telecommunication engineering many years ago, but already throughout my training as an engineer, I found holotropic breathwork and I found psychedelics, and I became very interested in that field. So then, at some point, the choice was clear that I wanted to become a psychologist and work in the psychedelic field, and that's what I did. I went back to university, I studied psychology, I finished my training in holotropic breathwork, and then I did as many trainings as I could related to psychedelic therapy. So I trained with MAPS in 2014, and I progressively got more and more involved in the field. And I also started collaborating early on with ICEERS, the foundation, and I provided integration sessions for people that had difficult experiences with ayahuasca. That's when I started getting somehow familiar with the field of integration, and that led to, developing a career in integration. That was never an intention that I had, but it happened somehow organically. And then in these last few years, I've been working more in clinical trials, so working during the active phases of the administration of psilocybin. I've been already in the scene for some years, and I feel that I've been lucky to see different ways, different contexts of use of psychedelics, from the recreational context at Boom Festival with the psychedelic emergency support, integration, clinical trials. So that's given me a nice overview of different contexts of use of psychedelics. So,
in popular culture, we often hear about bad trips, but you use the term difficult experiences. Can you explain why?
Yeah, I do think that there is such thing as a bad trip, but that would be a special kind of difficult experience. A bad trip, in my opinion, is when somebody is taking a substance for recreation. Maybe you go to a party and you take a substance, sometimes not even knowing the kind of effects that the substance can have, and then all of a sudden some difficult emotions come up, and we try to fight that experience, and at some point we might lose consciousness of what is going on. So we become psychotic in the sense that you're not in touch with what's really going on. For me, that would be a bad trip, because you didn't want to look inside, you just wanted to have fun, but you were confronted with very difficult material. But for somebody that's taking psychedelics in an intentional way, with knowledge of what are the potential effects, I don't think that there's such thing as a bad trip. There can be difficult parts of the experience, but if we are able to kind of go with these challenges and let go into the emotions, the fear, the grief, whatever, then they can transform into something that can have potentially good outcomes. So after the resolution of the difficult parts of the experience, usually people feel other things. They feel an opening, they feel some relief, they feel a sense of joy or being reborn in a way. So I think that challenging parts of the experience can lead to positive outcomes as well, if we engage them in an intentional way and in a kind of open and curious way. So that for me is not a bad trip, it's a difficult part of an experience that could also end up being a good experience considered globally. So,
in your work you have 7 categories of difficult experiences with psychedelics. Can you list those?
Yeah, that comes from my clinical work and talking with people that they had experienced difficulties. I try to understand the reasons of why those difficulties and what had happened in those experiences. So I talk about different aspects that can lead to problems in integration. So people that feel that need support after the experiences. And I've defined like different 7 categories, which are not totally independent. There can be some relationship between the categories, but basically it has to do with the lack of preparation, having a difficult experience that does not resolve well, what I call very traumatic experiences, which could be some sort of psychotic break, if you want, or a bad trip in the sense that we were talking before. People that had previous mental conditions that become reactivated after the use of psychedelics. Then situations that had to do with interpersonal stuff, like abuse, malpractice, neglect, or people that were not skilled enough to support the participants. Another category is people that take substances over and over and over again without integrating the effects and how they become progressively disorganized. Another category is the emergence of traumatic memories, people that all of a sudden discover or they feel that they see an abuse scene that they did not know before. So they start wondering, is this real? It is not real. And finally, there's also the experience of having been attacked by entities, energies, like bad spirits. Yeah? So that's also a type of experience that many times leads to problems in integration. So my idea was to describe these scenarios and then propose certain ways of supporting people in these specific states. And that's what I've been doing over the last years and what I'm teaching and sharing now.
Many people report about encountering extraterrestrial, extra-dimensional beings during their psychedelic experience. How can you work with those experiences if you don't share the beliefs of the participants?
Yeah, that's a very good point, because we see these experiences happening more and more, especially in the context of shamanic traditions or Westerners that go to shamanic traditions, but also nowadays in clinical trials with DMT. You know, people taking high doses of DMT, they talk about beings, entities. So in my approach to integration or to psychedelic therapy in general, I believe it's important to have a constructivist view on reality, meaning that there is not one single reality, but that each of us has a perception of reality, and that's actually what becomes real for us. Yeah? So it's not so important if I, as a therapist, share the beliefs of the client that I'm trying to support. What is important is if I can somehow understand those beliefs, if I can play the same game as my client, if I can work in the same reality that the client. Yeah. So okay, let's work now in a reality in which entities are real for you. You know, what's the implications of that? Why is that a problem, or how can I support you with that? So really working with the reality of the client has been the focus of my work.
We often use the term integration, but how can we define it?
Yeah, it's a very difficult question, because we use the word very, very often, and also to talk about different things. You know, the practices in integration are very diverse. So one basic definition that most of us could agree is that integration is what we do after the experience. Yeah, and that can be many different things. This can be like psychological approaches, community approaches. It could be like physical sort of approach. So I have never defined integration in a reductionist way. I try to use metaphors to kind of expand the different meanings of integration, because doing integration in a shamanic culture is completely different than doing integration in a clinical trial, but still those two activities could be considered integration in any way. So I'm more interested in finding definitions of integration that are actually expansive rather than reductionist. Yeah? So people can bring more and more meaning into what they could do to integrate the experiences. Integration in the end can be a very creative process that we can do on our own. So finding ways to create meaningful time and space for us to continue working with the experience, all that are integration practices, and each individual will find some specific ways of doing their own integration. So there's no need, I feel, for a very specific definition of integration.
Could you talk about some psychological methods of integration?
Yeah, I guess that there's many tools and many methods, but I like to differentiate between two different scenarios. The first scenario is when things have gone well, when the experience has been easy and people are not feeling any sort of complication after the experience. So then tools like artistic expression, journaling, writing, painting, sharing circles, putting words into experience, being in nature, dancing, and these sort of more collective approaches to integration can be really helpful. But when people have had difficult experiences and they are having some adverse reactions after the psychedelic journey, the tools that are needed to support these people sometimes are a little bit more complex, are more similar to psychotherapy, if you want. And then there's different ways of supporting those people. I have developed a method of supporting people after challenging experiences that is based on brief strategic therapy, so short interventions focused on helping the person to overcome these difficult symptoms, be ruminative thoughts, intrusive thoughts, depression, anxiety, panic attacks, these kind of things that usually appear after difficult experiences, and that can have a huge impact on the well-being of the person. So addressing those symptoms first, so then people can go into more meaning-making tools, or trying to find sense of the experience, or trying to find the positive aspects of the experience.
How can the therapist know when there is a need for a psychiatric intervention?
Yeah, that's a good question, and I do think that certain times there's need for psychiatric intervention. my approach to using psychiatric medication is more as an aid in certain phases of the treatment or the integration rather than a treatment in itself. So some people will have the need to receive some medication to help them sleep, to recover the natural cycle of sleep, because if they don't sleep, things can become more and more complicated. Yeah? So sometimes managing anxiety, managing insomnia, to allow the person to do the psychological work, it can be needed. But I would say it's a minority of times. Most of the times people will manage to go through the integration phase, even if it's challenging, without the use of psychiatric medication. But I'm not in total opposition of the use of psychiatric medication. Sometimes it is needed and can be very helpful.
Therapists are often exposed to very difficult experiences. How can they avoid burning out or negative mental health consequences?
Yeah, that's an important topic, because the work of a therapist is being confronted with these difficult situations every day. And in a way, it can have an impact in our own experiences. So psychotherapists that are also on a psychedelic path and they use ayahuasca or other psychedelics as their own healing tools, their experiences can be influenced by what they hear, all the difficult things that people experience, all the hard situations that people have gone through. That can become a part of your psyche, and you can encounter these things, or they can influence you in your own inner journeys. So I guess that finding a place in which you are taken care of as a therapist, so you don't have to hold the space, you don't have to be the responsible one, like you delegate that responsibility on somebody else and you go there as a patient or as a client. I think that can be very helpful to find these own self-care sort of activities, but mostly allowing somebody else to take care of you rather than you having to be the expert or the professional all the time.
There's a big debate in the psychedelic community about some therapists, professionals, researchers imposing their spiritual beliefs on their clients or research participants. What do you think about that?
I think it's important to talk about that. There's the potential for manipulation after psychedelic experiences. Research has shown that after a psychedelic experience, we are in a more open, vulnerable, and suggestible space. So everything that a therapist, shaman, counselor, or somebody in a position of authority will tell you can have a deep impact. Therefore, we are subject of more easy manipulation. So we as therapists should be aware that we can have that sort of influence. And definitely I think it's a matter of responsibility of not introducing your own agendas into the client, and definitely not imposing your spiritual beliefs or your psychological beliefs. One of the main core values of psychedelic therapy is non-directivity or inner directivity, that we direct the person towards their own insight, because that's where we believe that the answers and the healing lie. So when you take a psychedelic and you support somebody under psychedelics, you support their own journey. You're not trying to direct or modify or shift their journey in any way. You're encouraging them to go inside. So why should we do something different in psychotherapy or after the experience? I think that we should all follow the same logic and the same principle of, all right, non-directive or inner directive, and supporting the insights from the person. I think that that's one of the basics of this work.
Psychedelic treatment is a hybrid form of treatment between talking therapy and pharmacological treatment. Do you think it will find its way in mainstream medical care?
Yeah, that's a good question. I think that we will see a diversity in practices. As we are seeing today, there's a lot of underground movement. There's ayahuasca retreats, psilocybin retreats. People are using these substances already in diverse ways. I think that it's a matter of finding how this will be implemented in the medical system. Who is going to be administering that? What sort of training will people need to administer it? How cheap or how expensive this is going to be? Who's going to be able to access these treatments? Is this something that's going to be paid by the Social Security or the national health systems, or it's going to be something that is private? So I think that there's a lot of caveats there. How many sessions are going to be provided? When is it going to come? Is it going to be after, antidepressants and before electroconvulsive therapy, or after electroconvulsive therapy? Which order will this have? I guess that it's going to be easier at the beginning to make it happen in private clinics, but that raises the question of the access, no? How many people will be able to access that? But I don't think that we have yet clear the idea of how this is going to look like. And countries like Canada or Australia, in which these treatments can be prescribed, they are still struggling to find a way of how to make it happen. You know, like, okay, we can do it, but how do we do it? Who does it do it? Who does it pay the treatment? So there's still a complex situation. I don't think we're there yet.